Hello guys, welcome back to my channel Religiously Fit. I hope everyone is doing fine and keeping well. So guys, we'll be continuing with chapter number 16, emergency assessment. Okay, we completed half of the chapter in part 1. So we shall be doing part 2 with the rest of the chapter. The first topic here would be heat stress. Okay, so what I'll be doing, I'll be reading from my notes and then I'll be explaining wherever it is necessary. So heat stress is blood that becomes heated flows to the skin, okay, where the vasodilation occurs and sweating begins. So it's the body's ways of regulating the temperature of the body, thermoregulation, which is also called. So vasodilation is basically the vessels, they dilate, they expand. Okay, so when your body is dealing with heat stress, so what happens is the blood, which is high in temperature, it goes towards the skin, so that the vasodilation occurs. Okay, and it will come in contact with the blood will be in this particular area, so the sweating begins. The sweating will happen. Because of this, your body temperature will be regulated. Okay, so coming to the second point, diuretics, which are the medicines like for flushing out the water from the body. Antihistamines, antidepressants put stress on body's thermoregulatory system, causing people to profuse sweating, a lot of sweating. Okay, this reduces the blood volume and hence less blood to carry nutrients and oxygen to the working muscles. So this is heat stress. Okay, so diuretics, antihistamines and antidepressants, they also cause stress on the body system of regulating regulation of the body's temperature basically. Okay, so then comes heat edema, is the temporary swelling of the extremities. Extremities means hands and feet. Okay, then heat cramps. Heat cramps are spasms that affect abdominal muscles, arms, legs, causing cell size to decrease. So heat cramps are basically kind of spasm, or you can call a different kind of that comes under a category of pain. Okay, that affects abdominal muscles. Okay, arms and legs, so they cause basically the cell size to decrease. The solution would be rest, replace fluids and electrolytes. PT personal trainer can gently massage the area or apply direct pressure to the cramp. Okay, so these are heat cramps. Now coming to the next topic, which is heat exhaustion. Profuse sweating, that means a lot of sweating, weak pulse, dizziness, cold clammy skin, blood core temperature less than 140 degree Fahrenheit, less than or equal to or 40 degrees centigrade. Stop exercising, move to a cold area, lie down with your feet elevated, feet like this. Okay, and give fluids to the client and monitor the temperature. So these are heat exhaustion. Okay, so the symptoms are like a lot of sweating, weak pulse, dizziness, cold clammy skin, and body's core temperature is less than 40 degrees centigrade or 104 degree Fahrenheit, less than or equal to. Then comes heat stroke. Okay, I have written some other notes more serious than heat. Okay, so the severity of all these things, like I have written in the side note, that heat exhaustion is more serious than heat cramps, and heat stroke is more serious than heat exhaustion. So comes heat cramps, then comes heat exhaustion, then comes heat stroke. Okay, heat stroke is a failure of body's cooling mechanism, rapid strong pulse. Okay, the pulse would be very rapid and strong, dry skin, bright red skin, anxiety, irritability, labored breathing, like that is difficult breathing. Body's core temperature is greater than 105 degree Fahrenheit or 41 degrees centigrade. So this is the most severe thing. So you'll have to ask your client to stop exercising, remove clothing as much as feasible, cool the body immediately using some ice pack, fan, okay, or wet towels, give fluid and transport to emergency room immediately. So call 911 immediately. Okay, so heat stroke is the most extreme thing which can happen to anyone in terms of body's failure of regulating its own temperature. So this in this case you'll have to call 911 immediately. So again, I'll reiterate: heat cramps, then come heat exhaustion, then comes heat stroke. These are new terms, so don't get confused in between them. You might be asked questions on these in the exam. So heat cramps, I'll summarize again. Heat cramps are basically pain or spasm that affect abdominal muscles, arms or legs, causing the cell size to decrease. The solution would be rest, replace fluids and electrolytes. Like this would be for all the three things, like replace rest and replace fluids and electrolytes, and gently massage in case of heat cramp. Gently massage the area which is having spasm. Heat exhaustion is a lot of sweating, okay, weak pulse, dizziness and cold clammy skin with body's core temperature less than 104 degree equal to less than equal to 104 degree Fahrenheit or 40 degree centigrade. Stop exercising, move to cool area, lie down, feet elevated, okay, remember this, feet elevated. Give fluid and monitor the temperature. And then comes the most severe thing, heat stroke, failure of body's internal system gets failed. It is not able to thermoregulate anymore. Okay, rapid strong pulse, dry skin, bright red skin, anxiety, irritability, difficult breathing. Body core temperature greater than equal to greater than equal to 105 or 41 degrees centigrade. Stop exercising, remove clothing as much as feasible, cool the body immediately using ice pack, fan, wet towel. Okay, so these were the heat related thing. Now comes heat syncope. It happens immediately after exercise due to blood pooling in the legs, decrease in stroke volume, the heart stroke volume. Okay, how much heart volume, how much blood volume it can put out. Okay, that's stroke volume. Decrease in stroke volume, cardiac output and blood pressure. Okay, have the client drink fluids and rest with feet elevated. Can resume exercise in the next day if asymptomatic. If the symptoms vanishes, okay, then they are allowed to resume the exercise. In general, avoid exercise in extreme hot and humid conditions, okay, like 82 degree Fahrenheit or like 28 degree, more than 28 degrees centigrade. It takes 10 to 14 days for the body to get acclimatized to heat. So first few days reduce intensity and take more rest breaks. Okay, we are talking about heat syncope. In general, drink 500 to, this is an important question, I think this came in my exam. In general, drink 500 to 600 milliliter of fluids 2 hours prior to the exercise, 200 to 300 milliliter every 10 to 20 minutes and during the exercise, and 450 to 675 milliliter for every 0.5 kilogram of weight lost. Okay, do remember this, make some notes or look up in the book. Okay, and remember these facts, very important. Okay, now coming to cold stress. Cold stress is normally the body temperature is 98.6 degree Fahrenheit, which is 37 degrees centigrade. In cold environments, what happens is periphery of the body decreases its circulation to slow heat loss. Like we talk about vasodilation, where the body is experiencing a lot of heat internally. So what happens is it takes the hot blood towards the skin where the sweating happens and the blood is eventually cooled down. Okay, so the vessels get dilated. Here the opposite thing is happening. If you are working out in a cold environment, so body is trying to save heat as much as possible so that the body stays warm and it is able to do its fundamental functions. So the periphery of the body vessels, basically they decreases its circulation to slow the heat loss. Hands, feet, ear and face are often affected. As we all know, in winters, like hand, feet, ears and face are often affected. Okay, cells are made of water which freezes, thereby getting damaged and also injuring the nearby blood vessels. We are talking about extreme winters, okay, like we have here in Canada. Take the person to the nearest warm shelter, remove the wet clothing, pat the person dry and dress him or her in warm clothing and blankets. Keep the person lying down to prevent drop in blood pressure and call for medical help immediately. Okay, so these are the recommendation if the client is facing symptoms related to cold temperature, okay, or if they are wet in the rain. So now comes frostbite. Occurs when the parts of body, especially nose, hands, etc., are exposed to extreme cold. Tissues in those parts may freeze and die. So warm the victims and remove tight jewelry or clothing. Never massage the area or warm with heat pad, stove or fire. If warmed, throbbing pain may start. Tissue numb, yellow, gray, white appearance. Okay. So what they're telling is, if frostbite like situation has happened to your client, so basically Okay, remove all the any kind of tight jewelry or clothing they are wearing. Okay, never massage the area where they are feeling this kind of pain, or warm it with a heat pad or bring it close to the stove or fire, because that might start throbbing pain in that very specific area. Okay, and the symptoms to look for is the tissue numbing. Okay, like the fingers getting numb. Okay, yellow or gray white appearance. Okay, these are the symptoms of frostbite, which happens in if the body gets exposed to extreme cold. Again, like here, the temperature goes sub-zero, and so that might cause a person to have frostbite. Again, coming to the next point, seizures. Seizures is basically abnormal or excessive electrical activity in the brain. Okay, sorry, in the very layman's language, it causes are head injury, low blood sugar, poison, heat injuries. Okay, only 1% of all seizures occurs due to epilepsy. Epilepsy is a different condition. We are not going to cover that here. Okay, so tonic-clonic seizure, okay, which is also called grand mal seizure. Person experiences an aura, meaning a smell or sound that indicates a seizure is about to occur. Okay, I'll read it again for you. Person experiences an aura, meaning a smell or sound that indicates that a seizure is about to happen. Okay, so basically the whole body would start jerky movements, muscle contract and relax, jaw clenched. Okay, like they're holding a jaw like this. Bowel and bladder control lost. They might pee or poop in their pants because of this seizure. May last more than a minute, followed by a state of exhaustion. May stay unconscious for 10 to 30 minutes. So remember all these things. I'll say it again for you. May last for more than a minute, followed by a state of exhaustion. May stay unconscious for 10 to 30 minutes. Okay, remember this. We are talking about tonic clonic or grand mal seizure, where a person might experience an aura, which is a smell or sound that indicates a seizurement is going to happen. Okay, never place anything in the victim's mouth or restrain him or her. Clear the area. Place a towel under the victim's head to protect it from any injury, so that if they're banging their head, so they don't get an injury. Have someone call EMS after the seizure. Check ABCs. If not breathing, start CPR. Okay, if the seizure lasts more than 5 minutes or multiple seizures occur without the person regaining consciousness in between, then PT must call immediately EMS, emergency services. Okay, so if the seizure is lasting for 5 minutes or more, or it is going into back to back fashion, okay, without them gaining the consciousness, then call 911 immediately. Okay, now what happens is, why this thing happen? Contact sports, even those involving head trauma, are unlikely to increase the prevalence of seizure. I don't know. Sometimes even I don't understand my notes somewhere. Sometimes, anyways, seizures are less likely to occur during an exercise. It happens mostly at rest. Okay, very important to remember. It happens mostly at rest. If at all it happens during an exercise, these are long duration exercise like marathon, triathlons, due to factors such as sodium deficiency. Okay, so these kind of seizure might happen in case of when clients are doing a long sometimes I'm just lost of words. If they're doing long duration of exercise like marathons, so they might get into sodium deficiency, so that might trigger a seizure, but not when they are doing weight training and other kinds of training, not mostly according to ACE. Okay, now comes the next topic, which is shock, or called hypoperfusion. Blood not adequately distributed in the body. Okay, that is called shock or hypoperfusion. Cold clammy skin, fast and weak pulse. Okay, nausea, thirst, restlessness, irregular breathing, altered mental status. So these are the symptoms of shock. Have the client lie down with the feet elevated, check ABCs, and cover the victim with blanket. Okay, 4 types of shock we'll talk about. First one is hypovolemic shock. Lot of fluid, blood lost via internal or external bleeding, like in case of trauma victims. Okay, that's the first kind of shock, hypovolemic shock. Then comes obstructive shock, blood clots or other mechanical obstruction preventing blood from reaching the heart. Okay. Then comes distributive shock, vessels are dilated, okay, not allowing normal blood distribution. Example, spinal injury, head injury, food allergy or infection. Okay. Then comes cardiogenic shock, inadequate function of the heart resulting from heart attack or atherosclerosis. Okay. So these are the four different kinds of shock. You might see questions uh, making you confused regarding among these four. Okay. So just remember, hypovolemic is lot of blood fluid lost, okay, like because of internal external injury, hypovolemic. Then comes obstructive, like blood clots happens or some kind of mechanical obstruction is not allowing the blood to flow freely in the arteries. Then comes distributive shock, vessels are dilated, okay, they are dilated, not allowing normal blood distribution. And then comes cardiogenic shock, which is inadequate function of the heart resulting in the heart attack. Okay, four different kinds of shock. Okay, now we'll be moving to soft tissue injuries. The video is 16 minutes and how much content do I have? Okay, 2 more pages. Soft tissue injuries. So injuries to the skin, clean the area thoroughly, irrigate with plenty of water, apply a dry dressing. General primary treatment of soft tissue injury is rice. So rice is, rub ice on the injured area for approximately 20 minutes. So it is like soft tissue injuries which are happen externally on their skin. So basically, these are very very general things. You clean the area thoroughly with water, apply some dry dressing. You generally primary treatment of soft tissue injuries like rice, as we talked in the previous chapters. Okay, then comes type of skin cuts. Okay, so there are 5 different kinds of skin cuts. I'll detail them for you. First is abrasion, which is scraping of tissue. Then comes incision, a clean cut to the skin, like the doctors do an incision. Laceration is a jagged tear. It's an uneven tear. Okay, like someone met an accident. So laceration, uneven tear. Avulsion is severe laceration, skin torn away from the tissue. It's a severe form of laceration. Avulsion, AVULSION. Puncture is a penetration of the skin by an object, like it happens in road accidents. So 5 different kinds of skin cuts: abrasion, scraping of tissue; incision, clean cut to the skin; laceration is uneven tear; avulsion is a severe form of laceration, skin torn away from the tissue; and puncture, the penetration of the skin by an object. Okay, 5 kinds of skin cuts. Then comes fractures. Fracture is basically disruption or break in the bone continuity. Closed fracture is no break in the skin surface. Closed fracture. Open fracture is open wound, may have broken bone protruding throughout it, like again happens in the road accidents. So closed fracture is on the above, on the top, from the skin, everything looks good. Okay, nothing, but the fracture is internal, the bone is broken. Open fracture is open wound. Okay, you can see it from the external side. You see laceration, you see cut in the skin, you see a broken bone coming out of it. Then comes stress injuries occur when there is an imbalance in bone formation versus bone resorption. So stress injury. Okay, so stress injury is like injury when there is imbalance in bone formation. Okay, when there is an imbalance in bone formation, okay, versus the bone density. Okay, stress injury usually occurs in the tibia for clients involved in high intensity or high rep exercises. Okay, tibia, the lower part of the leg, the lower bone, just down the knee. Don't move the fractured area or attempt to put weight on it. Remove or cut away the clothing from the injured area to prevent contamination, infection. Apply gentle pressure to stop bleeding without disturbing the fracture site. Have the client lie down. Activate emergency services immediately. Okay, fracture is something which is like it's of concern, like it's a concerning thing, so you'll have to call 911 immediately. Okay, now coming to head injury. Again, I'll be reading and then I'll be explaining. Concussion is a brain injury that alters the mental status occurring during the contact sports. Blows to head can cause this. Okay, sudden blow again in the road accident. Okay, if your car is not having an airbag, then you just bang your head on the thing, that can cause concussion. Okay, signs of concussion is confusion, memory loss, asking same questions repeatedly, nausea, headache, slow as slurred speech. Okay, a common misconception is that the loss of consciousness always accompanies after a concussion. If consciousness is not lost, then concussion is not severe. It's a misconception. Okay, remember, guys. It's not like if you lost consciousness, then only it's a case of concussion. Okay. Unequal pupil size is an indicative of a serious head trauma. Okay, you see this pupil, so uneven pupil size, unequal pupil size. For any head trauma, PT should check the ABCs first of all and then start CPR if necessary. If they see no pulse, assume a spinal injury. If there's assume, like in a case of head trauma, always assume it's a spinal injury and don't move the head of your client. Don't move them basically, so that you don't make it worsen the situation. If they can talk, assess their level of consciousness by asking questions like victim's name. Okay, if a tooth becomes knocked out, PT should keep the tooth clean and place it in milk or salt water, or have the victim keep it in check area and see dentist immediately replant it. Okay, if because of the head injury some tooth gets knocked out, so just keep in milk on in the safe area, salt water. Okay, it's quite a lengthy chapter. Now coming to neck injury. Most common neck injury are cervical strain or sprain due to overstretching of neck muscles and traps. Okay, ice massage for 8 to 10 minutes to relieve spasm. Okay, cervical spine has 7 cervical vertebrae. Do not move the victim. Immobilize the head until the EMS arrives. Check ABC. Again, see, if these kinds of injury are happening to your client, God forbid, but if they're happening to your client, so first of all, head injury or neck injury, don't move your client. First of all, check their ABCs. If they have no pulse, start CPR immediately. Call 911 immediately. Okay, if they're unconscious, use jaw thrust method instead of head tilt. Okay, so if they're conscious, if they're unconscious, there are certain guidelines mentioned in the ACE. Just memorize them, understand them, and like by heart them. So if you come across any situation in the gym or anywhere, so you should be very much super duper active to start the treatment, like start these procedure as soon as possible. If the client is conscious, ask them a couple of names, ask them of any injuries or medication they are taking. If they're unconscious, check their pulse. If no pulse, then check and start giving CPR. Okay, if they're conscious, ask the victim to look straight ahead and not to follow trainer with his or her eyes. Okay, now coming to the point, coming to the next topic, back injury. Okay, so thoracic spine has 12 vertebrates. Okay, vertebrae, which is thoracic spine is the upper part of the spine from upper to mid. 12 vertebrae is kyphotic. Increase of this curvature is also called swimmer's back, where back is like rounded up, the upper part of the back, now also called swimmer's back, because the swimmers, they tend to do a lot of butterfly stroke, which makes them pecs tight. Okay, leading to kyphotic back. Then comes lumbar spine, the lower part of the spine. 5 vertebrae, allows flexion, extension, side by side bending. Gymnasts have exaggerated lumbar spine as their movements require hyper extension of the back. Okay, so these are different kinds of back injuries which might happen to, like for example, swimmers. They tend to have a swimmer's back, a kyphotic back, a rounding of the upper back. This might cause them an injury. Lumbar back is with the gymnast. They tend to curve their lower back, lumbar spine. Then comes herniated disc, or a bulging disc. It occurs between the L4 and L5, causing pain, weakness, numbness, and tingling due to nerve compression. So this happens in the lower part of your spinal cord within the L4, L5, causing pain, weakness, numbness, and tingling due to nerve compression. You might have like heard a lot of people, they tend to have back pain, so that might because of the nerve compression or a herniated disc. Okay, that's the same thing. Or that disc slips away, also called slip disc. Okay, so these kinds of things are back injury related to back. Lower back is estimated to affect 80% of the population. Tight hip flexors and hamstring can contribute to lower back pain due to counter pelvic tilts and posterior pelvic tilts. Okay, so as I said before, you might have heard people saying they have lower back pain. So tight hip flexors and tight hamstrings, they tend to cause a continuous stress on the lower back. Okay, like the hip flexors are pulling it forward, the hamstrings are pulling it backward. Okay, there's a continuous, because these muscles are so tight, so they put a continuous stress on your lower back, which causes a lower back pain. Do lower back exercises on daily basis and focus on lower back endurance rather than strength for maximum benefits. Lifting weights with slow controlled movement is the best to lower the compression and shear force on the spine. So whenever you are going to train your lower back for any sort of these injuries, or if you have lower back pain, so lift weights with slow and controlled motion. Okay, it will help you to gain more endurance rather than the strength, which is going to help you a lot with your activities of daily living, like pulling, pushing things, reaching out some overhead things. Keep objects close to the body, bend at knee while keeping your back straight, contract ab, leg muscles to assess the lift. So what they're trying to say is, whenever you're going to lift things up the floor, off the floor, try to bend your knees first, like we do squats. Okay, try to bend the knees first. Try to do a hip hinge, get into a hip hinge position, so that your back is straight and the work is being done by the glutes and the legs rather than the lower back. Avoid simultaneous bending and twisting while lifting heavy weights. Okay, like you have seen people when they do squats. Okay, they bend on one side or the other side, so their legs and glutes are not strong enough to do that movement swiftly. Rather, they are taking help from the lower back. So bending or twisting while doing lifting heavy weight might give you a back injury. Okay, maintain a good posture when doing all of the activities of daily living, as I just now mentioned. Okay, we have reached the end of this chapter. I thought there's a lot more because I made some other notes, but it seems like these notes are not from this chapter. So that was chapter number 16, emergency assessment. That was a long chapter. That's the reason I made two videos. I hope the videos are helpful to you. They add some value and context and information to your preparation. If you face any difficulty understanding any concept from Ace Personal Training Manual, just reach out to me on YouTube comments or Instagram with the same name, Religiously Fit. I will be happy to answer all your queries, and also give me some suggestions on what I should make next videos. I hope this was useful. I will see you in the next one. Good luck with your preparation. Thank you for watching. Bye bye.